Okay, this lecture is going to be on contraception, so essentially preventing conception. And there are a variety of reasons why anyone would want to do that. Perhaps they are not healthy enough to have children, perhaps they've already had children, perhaps they have no interest in having children. Also from a broader and less of an individualistic perspective, population control. And maybe we're overpopulated, and that could be humans or really any other animals. So for humans, the dream contraceptive, okay, the thing that's able to prevent pregnancy, fertilization, conception, would be free, 100% guarantee, fully reversible for any person, right? Man, woman, however you identify. And take really no conscious effort, not interfere with sexual activity, and have no side effects. Oh yeah, and can you prevent STDs too? We don't want any of those infections. We don't have that. There are a number of choices out there, and I'll walk through some of the most common and most popular ones, and these are the things that we have. Unfortunately, nothing checks all of these boxes. A lot of these cost money, or if they don't, maybe they're not as effective. Some are reversible, some are permanent. And we'll see too, the majority of this burden is placed on women, which is incredibly unbalanced. And a lot of these things too also may interfere with the freedom of having sexual intercourse whenever you like. So let's back up and talk about this from a broader perspective, so from a population control. Okay, if we think of humans, again, just as kind of animals in a population, okay, we have kind of what's considered a carrying capacity for the Earth. The Earth is only so big, it's not getting any bigger. We're actually being a little bit unkind to it right now. And the carrying capacity of the Earth in terms of humans is somewhere between 4 and 16 billion people. We are there. Okay, the human population is currently over 7 billion. Okay, why is that a problem? Okay, if we have too many people, we're going to run out of Earth. There's just not going to be enough resources for humans to live. And if we look at this population of the Earth in billions of people, really there weren't that many people in these, early BC times. And, the population would kind of go up and down if there were plagues, infection, widespread disease, those sorts of problems. But in the modern age, and we're getting pretty close to where this figure, we're going to have to revise it soon. Human population has really gone up, and we can thank modern medicine to a lot of that, in that we have cures for diseases. We understand disease prevention. Surgeons now wash their hands before they do surgery. That was definitely not always the case. We're able to contain infection. We're able to spread information and help each other out. And that's great. We're all living longer. We have more people, but now we might need to think about population control a little bit. So there's going to be that sweet spot where we have enough people living, enjoying their resources, and there's not too many. What happens with a population if we go over that limit? And again, I don't know if 7 billion, 8 billion, I don't know if we're there or if we could potentially double. That's just a guess. But if we do have too many people, the population will crash. We'll fall off the cliff and we'll go back to some of these, older BC ages where, now we're kind of starting from scratch again. We've fallen off the cliff, widespread death and disease, and we cannot live on the earth anymore. So this puts kind of a little bit of perspective on why someone might want to family plan, why someone might not want to have as many children as possible. Incidentally, the average woman, if she really just turned herself into a baby factory, based on the number of ovulations and time it would take in between pregnancies, she could have 37 children during her reproductive lifetime. I don't know anybody that's done that, but there are certainly some of those documented reality shows out there, 19 children and counting. It is possible to really have a lot of children out there. If you have any more than two, more than just replacing yourself, you are contributing to an increase in population. If you have less than two children, you and your spouse, right, you are kind of contributing to turning that trend downward, right, and reducing the population of the earth. Okay, so let's talk about how we accomplish contraception if we do want to indeed reduce the number of pregnancies that we're having or family plan. Like I said before, most of these methods are targeting things that happen in the female reproductive system or her organs. There are some male options that we'll talk about as well. Okay, and they're going to work at different points. Okay, so if you're interested in an oral contraceptive pill, this is really going to regulate the ovarian cycle and if an egg ovulates and is released from the female reproductive tract or not. So this happens very early in shutting down ovulation, these pills. Downside to the pills, you got to remember to take them every day. Okay, something like abstinence, simply just not participating in sexual activity. Okay, that works for females, also works in males in terms of preventing interaction of sperm and egg. Okay, kind of moving down this list, we'll take a look a little bit further. Tubal ligation. This is a permanent method of birth control, okay, and what's done here is ovulation is not prevented. Ovulation will happen, egg will be released, but if we interrupt the pathway that the egg and the sperm must take as a fertilized zygote, egg and sperm will never get together, zygote will never form, and embryo has no path into the uterus. So this isn't preventing ovulation, but it's preventing egg and sperm to get together. Okay. Intrauterine devices, these have become a lot more popular lately. These are a longer term birth control. They can be inserted into the uterus, and what they're going to do is they're either going to prevent the union of sperm and egg, or they're going to make a uterus a very unpleasant place to implant, and therefore you make it a 7-day-old embryo, but it's not going to be able to implant and do anything beyond day 7. So we will get conception here, but we won't get a pregnancy. Okay, so that's two different ways that an IUD can work. Let's switch over and look a little bit of male. So abstinence, check both male and female categories. You can have what's called a vasectomy. This is really similar to the tubal ligation procedure, just like the oviduct is cut, so egg can't be transported. And what's going to happen here is the vas deferens or ductus deferens is cut, and then the sperm cells will not be able to travel down their pathway and leave the male reproductive tract. Okay. The male condom is probably one of the most accessible, pretty much at any corner grocery store or drugstore. Very easy to buy this over the counter, as opposed to a lot of these other things that would require prescription or surgery. This is very easy to get, and this is just going to prevent this semen from leaving the male reproductive tract and entering the female reproductive tract, creating a physical barrier here. Okay, so that's a little bit of an overview. We can see that there are many more methods for women versus males, and we'll just go through a little bit of the finer points as we walk through the lecture. So hormonal birth controls. These are really advantageous for women in that they shut down ovulation. If you take your pill exactly as prescribed, they are very effective. Now, is everyone taking them exactly as prescribed, which is at the exact same time every day, never missing a dose? Probably not. in which case you're going to want to use a backup birth control method, because that takes us out of the 96, 97, 98, 99% effectiveness of hormonal birth controls and drops us a little bit lower. These are sometimes used for other reasons in addition to preventing pregnancies. These are going to regulate hormone levels. So if you are someone that suffers from one of the most common endocrine disorders afflicting humans, polycystic ovary syndrome, or perhaps endometriosis, or maybe even have acne, anemia from excessive blood loss, if you have postmenstrual syndrome symptoms, anxiety, depression, mood swings, you might want to take a hormonal birth control. There are other benefits than just not getting pregnant and not ovulating. Disadvantage is you do need a prescription, so gaining access to this birth control. Does it cost money? Is it free in your country? Is it not? What's the current policy on it? And hormonal birth control pills do not agree with everyone. They could exacerbate some diseases. So even though we think maybe it's good for some anxiety, depression, PMS symptoms, for other people, that combination is just not going to work. And you're really not going to know until you take the pill for at least 3 or 4 months and track your symptoms and talk to your clinician. If you're a smoker, you're probably going to want to stay away from the hormonal birth controls. This can affect blood clotting. This can be dangerous. Incidentally, there are some hormonal birth controls available for men. This is the new and modern era. As we move through our current year, these are available, but they're not as popular to men because of a lot of the same disadvantages that women experience. So even though kind of the standard, what women have had since the 60s with their hormonal birth controls, it was such a triumph for us to have this power to prevent pregnancy or to control our reproductive health. Men are shying away from this and not as interested in hormonal birth controls because of some of the side effects. Understandable, but also a little bit frustrating that things aren't equal for everyone. Okay, there are more than one types of pill. So if you just say to someone, are you on the pill? And they say yes, that really doesn't give you a lot of information. There are lots and lots of pills out there. And again, just because you try one and it doesn't work for you or exacerbates some side effect or symptom, you might want to try another one. This is a US favorite, although it seems like the IUD is gaining traction lately. I might have to revise some of this. Again, we have very low failure rates. This is 97 and 99% effective if you take it correctly. In 1937, the first oral contraceptive pill was available. And what we found out too in the 60s, again, which was very landmark, that using even a lower dose of estrogen than originally thought necessary was still efficacious. And with lower doses, it probably means less unpleasant side effects. The mini pill came after the combination pill. So combination pill was a combination of estrogen and progesterone. Mini pill is progesterone only. There are less adverse side effects. People do tend to bleed a little bit on this. This might be a reason not to take it. And the failure rate is just a little bit higher. So creeping into 90%, 95%, as opposed to the combination pill, which is just a little bit better if taken as prescribed. So what if estrogen doesn't agree with you? What if you are a person that does have a lot of these unpleasant side effects? You could try progestin implants. This was short-lived and has recently been revived. The Norplant was taken off the market in 2000. So it was good for about 5 years, but what they found out in that 10-year period that it was on the market is as they were implanting this device underneath the skin, usually in the arm, it was quite a challenge to remove it. And some patients were scarred. It was revised and is back on the market as Implanon. One implant as opposed to 6 of these little matchstick size implants. And that is now on the market. We will see if people fare better with that. The Depo-Provera, this is called the shot as opposed to the pill or the implant. This is injectable every 3 months. So you don't have to worry about forgetting it, like forgetting to take your pill. You don't have to worry about the scarring that might be associated with an implant or anything uncomfortable associated with that. But there are some concerns with loss of bone density, particularly in the jaw. People that are on Depo-Provera for years and years, they tend to, or are increased risk for loss of bone density. So that's something you want to watch if you are interested in the Depo-Provera shot. Also, you do have to make an appointment with your doctor every 3 months. So again, what's your access to health care? Okay, so if you are a little bit more forgetful, or again, the pill does not agree with you, things that you can try would be the patch. This is transdermal, so you simply put it on the skin. We have the model here really putting it in a variety of different places, and the hormones will just be transmitted transdermally across the skin. Okay, still affect the ovarian cycle and prevent ovulation. Still a hormonal contraceptive. The ring or the NuvaRing, this is also something that's really easy to use at home. The NuvaRing is this kind of jelly-like ring. It's very distensible, and you simply insert it into the vagina, press it up towards the cervix. It's just like putting in a tampon. And this, what you do is you leave it in for 3 weeks, pull it out for the 4th week, regain your menses, and then you put a new one in. So the patch and the ring are nice in that they're a once-a-month treatment. You kind of set them and forget them. Again, there can be side effects associated with these as well, because just like any of the pills, they are hormonal contraceptives. Okay, now what if you really forget or you have an emergency, something happens? There is an option for you. It's called the morning after pill or Plan B. The reason this pill is not Plan A is because you really should be using some other type of method. This is really in cases where things go wrong. You don't want to be taking Plan B regularly. This is like hitting the hard reset button on your uterus. Okay. This is going to give the body a really big dose of hormones. It's going to disrupt ovulation. It's going to affect transport if there is a zygote in place. This is going to make implantation impossible, and you will go through, even if you're mid-cycle, okay, you're going to experience and have to reset your cycle. Okay. Again, this is only for emergencies. You should not be trying to use this as your primary method of birth control. Please use something else. Okay, intrauterine device. Again, this is really nice if you want to prevent pregnancy for a long period of time, 5 or 10 years. These are great. They actually have a lower failure rate than hormonal, so they're very effective. They're typically plastic or copper. The downfall to this is that small surgery is required. Okay, you will have to have them inserted directly into the uterus. So we would have to dilate the cervix a little bit. That little copper or plastic T will be inserted, and then that just makes a very unpleasant place for the uterus to be. So zygotes don't want to hang out there. They don't want to implant. If you're someone that firmly believes that life begins at the moment of conception, you might not want to use an ID because you still can get pregnant. You might have a zygote, but again, the zygote's not going to survive past day 7 because it won't be able to implant. This is popular among monogamous women, people that are trying to plan families, multiparous women, women who've already had multiple children and perhaps are done or think they might be done for the next 5 to 10 years. Okay, what about male birth control? So what they've been teasing us with, as I said before, there are hormonal options, but they're really not popular and they're not really gaining much traction. I think what has the most promise is something called Vassal gel. This is developed under the principle of reversible inhibition of sperm under guidance, right? Or we can just abbreviate it RISUG. And this mechanism of action is really just injecting a barrier, a jelly-like substance, into the ductus deferens. So that way, sperm cells are created. Everything's normal with testicular function and hormones, all yours, all natural. And then the sperm will not be able to travel through the ductus deferens because it's filled with a solid jelly. And the man is still able to produce semen and ejaculate. Remember, 90% of what you're producing is coming from the seminal vesicles and prostate. So you're not even going to notice a difference in your ejaculatory volume. And theoretically, this is reversible. So all you have to do is go back into your clinician for a second injection to wash out the gel, and then you can go about family planning then. So kind of similar to the IUD, that you can leave it in there for 5 or 10 years and then take it out when you're ready to have children again. So this has been really popular in India. It's on the market. It's working. It has not passed, forget if it's FDA or USDA guidelines, FDA guidelines. It's not passed that yet in the US. So they're coming up with a new formulation that will get around some of those. And that's what Vassal gel is supposed to be. Okay. It was promised in 2017. That year has come and gone. I really hope to see it on the market because that's going to be the new IUD for men. And it's going to be much more, I think, reasonable and much more popular for people. Okay. And if you don't agree with hormones and you don't want to do anything that's semi-permanent, spermicides and barriers are always a great option. They're hormone-free. Spermicides are going to destroy the sperm cells, so they can be applied either with a condom or a barrier method, or they can be applied directly to the vaginal canal and cervix. Okay, so that's going to be really helpful. There is kind of a big failure rate, anywhere between 3 and 21% with spermicides. But again, if you do spermicide plus a barrier, then you're going to be more up in that 90% range and a lot more covered. You're actually better off with a spermicide and a condom than a hormonal birth control pill if you are a forgetful person. Okay, so the male condom and spermicides are more effective than a person that forgets to take their birth control pill. I feel the need to say that twice. You can always use all three too. Okay, condoms are great too because they also prevent STDs, sexually transmitted diseases. Okay, don't forget, chlamydia is definitely on the rise in the United States among the younger population, people up to about 25 years of age. That is becoming of epidemic proportions. HIV, very deadly. We want to avoid these types of things, right? Female condom, less popular, less effective, just use the male condom. And there's also the option to get fitted with a diaphragm, a cervical cap. This is something that fits over the cervix. This requires a little bit more effort than a condom. Condom you can pick up in any drugstore, any corner store. A diaphragm has to be fitted to your body. Women have different shaped and sized cervixes, but that it does work as a barrier. And again, with a little bit of spermicide, that is very effective. Okay, moving over into permanent contraception, tubal ligation for women, where the oviduct or uterine tube is actually cut surgically, and the same thing, vasectomy, where the ductus deferens is actually cut, right, surgically. Okay. For women, the tubal ligation, this is a major abdominal surgery. You do have to cut through the skin, 3 layers of abdominal muscle to get at the uterine tube to ligate. This is often a common procedure if C-section is being done and those tissues are already opened up and the woman knows that this is her last pregnancy or she doesn't wish to have any more children. This is often a great time to have that done. Otherwise, it's a somewhat invasive surgery in that you have to cut through the abdominal wall to do this. A little bit less invasive in males. All you have to go through is just a very thin layer of scrotal skin and tie off the ductus deferens. So both of these require surgery, slightly less invasive in males because of fewer layers of tissue to cut through and to heal. Okay. And again, if you don't have access to any birth control for whatever reason, or you don't use the other methods for one reason or another, there are some ways to naturally family plan. These are not terribly effective, but you can use the rhythm method of birth control. If you avoid sexual intercourse 5 days before ovulation and 1 day following ovulation, you will be able to avoid pregnancy. Remember, this has to do with the sperm cells being able to live for about 3 days or 4 days in the female reproductive tract, and the egg having about 1 to 2 days on its clock after ovulation. So if you avoid those days that the sperm and egg can potentially be in the female reproductive tract at the same time, just before and just after ovulation, you can avoid pregnancy. What you have to be able to do is know with guarantee when ovulation is coming. And even though women on average have a 28-day cycle, some women are much more like clockwork and much more predictable versus other women that ovulation might be plus or minus a couple days. So that's really going to increase your window of when you should not have sexual intercourse if you're not really 100% sure when you're going to ovulate. And really the only way to know when you ovulate is to count backwards from your menstrual cycle. So you're trying to predict the future a little bit here. If you use this calendar method, this is trying to help you pinpoint these 5 days around ovulation. So you monitor your menstrual cycle for an entire year. Okay, and then you can subtract 18 days from your shortest cycle, 11 days from your longest cycle, and then you don't go between X and Y. That should keep you covered. The lucky women are going to only have a 5-day window. Women with a much more variable cycle are going to have a bigger window there. Other ways to naturally family plan too. This requires having a baby in the first place, but if you breastfeed and you keep your baby breastfeeding early and often, you will produce high levels of prolactin, and those high levels of prolactin will inhibit ovulation for up to about 6 months. Okay. The thought there is the human body is already supporting 1, the woman's life, and 2, the infant's life for about 6 months. And if you're breastfeeding, you're not really going to have enough resources for a 3rd human, right? Having a 3rd baby, or 1 adult, 2 babies. So you're not going to have enough resources for 3 people. If you stop breastfeeding, then that baby is, self-sufficient, eating other things and existing, then your body will return back to menses and ovulation a lot sooner. Okay, so I refer to these as the most not reliable methods of birth control. You really shouldn't rely on just breastfeeding and just counting the days of your menstrual cycle, because things can be a little bit more variable. but there are lots of choices out there. All right, that's the end of the lecture.